biggest unmet medical needs in myeloma right now are really frail elderly, renal failure, and high-risk disease. And I think we still have work to do. I think for high risk in particular, many regimens have improved high-risk patients' outcomes, but none of them match standard risk. So they're doing better than they would without the drug, but they still lag behind. I'd like to see the point where they do just as well. Same thing for frail elderly and same thing for renal failure. If we can get these Kaplan-Meier curves to be the same for everybody, we're making huge progress. There are not specific studies focusing on these. Part of it is the complexity of doing these studies, right? So elderly, frail patients are hard to enroll in studies. They may be in the community, not easy to get to academic medical centers. Renal failure patients are often excluded from clinical trials, which is one of my pet peeves. I think all clinical trials should explore the renal failure cohort. And with high risk, the challenge is it's a small subset, so it's about 20% of patients initially goes up as we get higher, but it's complex to do a study just on those patients. And also, to really do a good high-risk study, you need all four groups represented. You need standard risk with standard therapy, high risk with novel therapy, standard risk and high risk patients with standard therapy, and you need standard risk and high risk with novel therapy. Because if you don't have all four groups, you can't tell if the high-risk patients are just doing better or if you've really overcome. And so you really need, and it's a complex study design, but work's being done on that.